So hi Jubin, thank you for having me over. My name is Varun Jhaveri. I work at the National Health Authority uh, for the Government of India. Uh, I've been working there for last couple of years. I work there as an officer on special duty. Uh, the National Health Authority manages the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, which is the world's largest health assurance scheme. And in my current interaction, I'm speaking in my personal capacity. Ayushman Bharat is the, as I mentioned before, is the world's largest healthcare assurance scheme. But what that entails is that it covers 500 million citizens. So somewhere around 100 million families, and for every family we provide a coverage of 5 lakh Indian rupee. So that translates to somewhere around 8 to 8.5 thousand dollars per year. And this particular financial protection that we are providing, that is for the hospitalization expenses. So, if you require to get hospitalized, the Ayushman Bharat covers this particular, part. And the target behind covering this beneficiaries is to target and provide this protection to all the poor and vulnerable families of India. So, through the coverage that we are doing, we are covering 40%, or rather more than 40% of India's population. So, by the sheer scale that, that we are covering, this is a large program. It started during September 2018, and very soon we are going to hit, providing treatment to around 1 crore beneficiaries. So, around 10 million citizens would have got benefit of free treatment through this program just within, somewhere around 1.5 years. I think the program has made I would say a good start, and it has been implemented in 33 out of 36 states / union territories, which by far are like the provinces. If you look at the the European terminology. So pan India coverage, and we have 21,000 hospitals which are providing the services. So, out of that 21,000, 50%, close to 50% of them are private hospitals, and the other 50% of them are public hospitals. So it's a very good mix of, both the types of healthcare systems, coming along. And, the core idea behind this is how to improve the access, affordability, and the quality of care, which is given to the citizens of the country. In terms of COVID, I think there are two big aspects that we are working on. The first is that when you talk about COVID, the poor and vulnerable population, they are the one which will be impacted the most because of the financial outlay or the financial expenditure, which might come for the testing and the treatment. Right now, if you look at India, the government is providing free testing at the public facilities, is providing free treatment. But as this case scales up, as the numbers grow, we need to involve the private sector also in this, in this entire, COVID response. So what we have done is that through the Ayushman Bharat scheme, we are now covering this 500 million citizens with free COVID testing as well as COVID treatment in public as well as in private hospitals. So what we are trying to do is that we are trying to safeguard, all this particular vulnerable population who are our beneficiaries. So, any of the beneficiary who gets, COVID positive, we pay for the test as well as for the treatment. So I think that is a, number one intervention that we are doing, and we are doing this for, all the 500 million beneficiaries that are there in our network. The other thing that we are doing is that, along with the COVID spread, the non-COVID diseases and the non-COVID health-related issues, such as, dialysis, chemotherapy, heart bypass surgery, gallbladder stone removal, all these surgeries and diseases, they have not reduced. And what is happening is that there is so much focus on COVID that the non-COVID needs have actually taken a back step. So I think that is where our Ayushman Bharat focus has been a lot, that how to ensure that the people who are still requiring this particular surgeries and medical treatments, how to ensure that there is a continuum which happens, and that is what we are trying to ensure, that although we are focusing a lot on COVID, there is also an enough focus on non-COVID related specialties that we are doing. And of course, there are other things that we are doing, like spreading awareness, calling people who are which have been quantified as susceptible through the Arogya Setu app. So we have been undertaking multiple activities, but I think let me stop there. We can probably deep dive into some of them in the later part.